Welcome back. You're watching the India Development Debate special, where we are marking, noting and analyzing the last 6 months. Exactly 6 months ago, the first round of lockdowns began. At that time, many in this country didn't even know what a lockdown was, how it would impact their life. And believe me, it has impacted everyone's life in some way or the other. So far, we've spoken about the impact on the economy, on business, on jobs. Now we're going to talk about the health segment. We know the numbers. We know India today is at 57 lakh cases in all, number 2 in the world. We also know that our mortality rates, or the number of people who are dying per million, are relatively lower. But is that just a function of statistics? And if the numbers are so low, did we need such a severe lockdown? If we needed that lockdown, why haven't we managed to flatten the curve? Well, these are some of the questions that I will be putting to Dr. Vinod Paul, who's joining us on the show this evening. He is a member of the NITI Aayog. Dr. Paul, it's a pleasure to speak with you. Let me start with a very basic one, since it is 6 months to the lockdown. Was this surge in cases that we are facing today inevitable, considering the size of our population and the density of our population in cities? And if so, was the lockdown truly necessary?
Well, I think what you need to appreciate is the timing of lockdown was a very critical moment. Lockdown was instituted at a time when it was becoming very clear that there is an exponential rise in the cases. And that was a devastating rate of rise that was being witnessed in the third week of March. At that point in time, you may recall the doubling time was 3.5. The current doubling time is 35 days. You see the difference. And growth rate was going above 15 to 18%. And it was evident that if this sharp increase is not stemmed in the beginning, the consequences will be devastating, as have happened very rapidly, very quickly in several other nations, and we have the knowledge available to us. So the lockdown happened once the exponential rise in cases became evident. I must say that following the first lockdown, in about 12 days, the response happened. But before that happened, the growth rate from that 17-18% pre-lockdown actually rose to about 23% on a day-to-day basis. And then it started to decline systematically. And over the period of the remaining lockdown, and if you have the visual to show, you will see that it started to plummet consistently, and from a high growth rate of 22.6% or so, we settled to about 3%, and then even less than that for the future times to come. So please remember that the lockdown did, which was in a way a devastating blow to the transmission chain of the virus. We knew it, that lockdowns do not, take away the virus once and for all. But then it did give us time to be prepared for facing the future ramifications of the pandemic, in terms of our preparedness for testing, in terms of testing laboratories and capabilities, our health facilities, which came up in thousands and thousands, ICU beds, protocols, and so on and so forth. And also, it prepared the nation to carry out behaviors that are COVID-safe behaviors. So there are huge gains of the lockdown. But the timing of the lockdown was such that if we had not done it at that time, the rise would have been very steep. And there are mathematical models which say that today we have only about 9 lakh, let's say, active cases. We would have faced something like 70 lakh active cases in the month of May, and there was no way that we had the coping facility. So those devastations have been avoided. Yes, we paid a price, but we did it at a time when it was strategically perhaps the most useful, and the mathematical model and science shows that doing it in a stage of steep rise had lasting effects over a period of time. And also there's data now coming up which shows that the R naught, the actual R naught, declined from something like 4.5 to close to 1.3 or 1.4, and that has been consistent. We did not go back to the same steep rise, and the gains are there even today. And of course, you know our estimates on, I say, end of lockdown 2, which there are more saving of life in due course, and the gains of lockdown we are still due.
Dr. Paul, we've had, the concentration of these cases in certain pockets. The Prime Minister also met with 7 states recently to look at why there's a concentration here. What is the reason? Is it mismanagement, or is it only because these places are densely populated?
Well, remember, India is witnessing pandemic at different trajectories in different states and regions. It must be appreciated that the pandemic is not at the same stage of its evolution in every district. It's not a uniform, evolution of the pandemic, and you would expect that because we have a very heterogeneous population density, population characteristics, and so on and so forth. And remember also the fact that population doesn't get affected equally in urban areas vis-a-vis rural areas, and so on. So what has happened is that our original phase and the intense phase that we are still experiencing is actually in those cities and districts and states where the pandemic started early, with visitors coming from other countries and seeding the virus. So it had to be therefore Mumbai, it had to be Chennai, it had to be Ahmedabad, it had to be Delhi, and so on. And from Mumbai, a very active state like Maharashtra, then to suffer more than other states. And Gujarat suffered like that, and currently Chennai and Tamanna is suffering.
Right. Tell me now, let's take a look at what next really. We're all waiting for the vaccine. What is your estimate, Doctor? When will Indians have an affordable vaccine which is widely available?
Well, firstly, we are very fortunate that we have a scientific enterprise as well as entrepreneurial enterprise in terms of our manufacturing capacity and our industry. That we are the leading nation which will develop the vaccine and manufacture one or more vaccines. You are aware, I'm sure, that there are two Indian vaccines in advanced phase 2. And then there is Oxford vaccine, which is in advanced phase 3. And all these 3 vaccines are being manufactured in India. There is a potential for additional vaccines as the time unfolds. So we are in a unique position in terms of our vaccine security, our vaccine access in due course. However, our best guess is that in the most optimistic scenario, a vaccine could be made available in the early part of next year. That would be the optimistic way to look at it. But till then, we have a social vaccine that we should really embrace, and that deals with masks. We should all be wearing masks in public. Mask is tremendously useful in curtailing the spread of virus from one to the other. 100% coverage of masks is a way forward for all of us. In addition to, of course, social distancing and 2 gaz ki duri, avoiding large gatherings, having festivities which are small gatherings with full protection, with masks and so on.
Absolutely. The basics have to be kept in place, Dr. Paul, as you say. That is our best and safest social vaccine. Thank you so much for speaking with us today.